first talk to me about any of the results from the study that either surprised you or threw you off a little bit or anything of that sort?
So the one thing that we were a little bit surprised with is the low rate of ischemic stroke in patients with COVID-19. Other studies have reported slightly higher rates, like 2 to 5%, depending on which patient population the study was done at. Our study, the rate was 0.9%, which, it's definitely, these strokes we found were more severe than strokes that happened outside the setting of COVID-19. So, these strokes are still important, although the rate is low. They're important strokes, but we were a little bit surprised by the low rate of stroke we found in our study.
So what are the difficulties in telling if a stroke is COVID-19 related diagnosis?
Well, there's no way to tell for sure if the stroke happened, due to other conventional reasons for stroke, or the stroke happened because of COVID-19. One thing we found in our study is, most of the strokes that happened in the setting of COVID-19 infection, these patients had elevated clotting factors in the blood, which hints towards maybe there's some increased clotting with COVID-19 that may be triggering the stroke. Obviously, our study does not answer this question. It just drives the hypothesis that, where others also have described that, there's increased clotting in patients with COVID-19. We don't know if it's the COVID-19 infection, the virus, that's causing increased clotting, or because, these patients, unfortunately, they're very sick with COVID-19 in general, and sicker patients are more likely to develop blood clots. So it's hard to know if there's a causal association between the two or not. I think definitely our study moves the field a little bit more, and trying to understand if COVID-19, what are the characteristics of patients who have a stroke in the setting of COVID-19, to try to understand if there's an association between the two or not. And I think we definitely need more studies to shed light on this and see what others found in terms of, that they find the same thing, where the clotting factors increased in, other patient populations with COVID-19 who had a stroke. So I think we definitely need more data on this to be able to answer this question definitively.